Assalamu alaikum to all of you, dignitaries and friends. I'll request to keep your mobile on silence mode, please, so that my concentration as well as your concentration will be on the target where I want to put it. Please. First of all, giving me opportunity to deliver my talk here. In this regard, first of all, I owes my thanks and regards from bottom of my heart to Nema Science Academy's founder, Hakim Sayyid Khalifatullah Sahab. It is indeed honor and privilege me to speak in front of him. Secondly, I extend my thanks to Dr. Yasser Arafat, who have suggested my name. He not only suggested but emphasized Dr. Amin Saab just to keep my lecture. And lastly, the project director, Dr. Amin Saab, who agreed with the recommendation of Dr. Yasser Arafat, and they have trusted me and give me the topic, that is practical approach on Ilaj with Tadbeer. Next slide, please. I am Dr. Khan Mohammad Qaiser, Associate Professor, Department of Tahfuzi wa Samaji Tib, ZVM Unani Medical College, Pune. Next, please. Now, so far this topic, the practical approach, I will not emphasize on individual topic of our individual regime on Ilaj with Tadbeer, just to have what exactly the Ilaj with Tadbeer, how it incorporate and embodied in the philosophy and conceptual structure of Unani medicine. So this is lecture outlined Unani medicine, Ilaj with Tadbeer and its conceptual philosophy, approach of Ilaj with Tadbeer in day-to-day clinical setting. So now I will emphasize these both things. What happened, friend? How many of you are Unani medical practitioners? Just raise your hand, please. All are, alhamdulillah. Now, what happened in our day-to-day clinical setting, when we goes in front of people, when we travels, when we come in contact with authorities, the moment they recognize us that we are Unani practitioner, so immediately they ask, what is Unani medicine? How many of you have come across of such situation? I'm asking you, please. How many of you come across of such situation that you are being given task to introduce Unani medicine? So this is the moment where we lost everything. We are not in capacity to introduce Unani medicine up to the task and to justify it. What exactly the system is, what is the Unani medicine, and what are the method and what are the regimes and what are the way of treatment in Unani medicine. So I'll start with the introduction, what exactly the system is and how Ilaj with Tadbeer have been embodied in its conceptual philosophy. So next slide, please. Unani medicine so far have been brought, originated in the Greece, and the five philosopher in between the period of Bukrat and the founder of Unani medicine is Ascalibus. Okay? So there are five philosophers, Plato, Pythagoras and Aflatun, Aristoteles. There are many philosophers. So these philosophers, now Unani medicine when originate, the philosophy was the main base of every science whichever you want to learn. That's why the incorporation of mantik or logic has been included in the syllabus of the Unani curriculum. So the knowledge of philosophy was the base at that time, and when Bukrat or Jalinus laid the foundation of Unani medicine, they incorporate the philosophy in the concept of the Unani medicine because it was mandatory norm at that time. Nowadays, it is rule that one has to be passed SSC and then 10+2 and then has to got admission in the BMS, BMS and so on. But in that time, the philosophy was the basic norm, and that's why Tib is defined according to Arastu is an art designed to cause benefit to human body. What is the benefit? That is the health, the ultimate goal. So according to Arastu, the definition of the tip, it is an art to give benefit to the human body. Now the Ibn Sina has credit to systematize, to conceptualize the Unani medicine to the extent where we understand it in today's scenario. The canon of medicine is the foundation of Unani medicine of the level where we recognize or understand it in today's scenario. So Ibn Sina give the definition of Unani medicine, the science by which we learn the various state of the human body in health. It is a science where we learn various state of the health when not in health. The mean by which health is likely to be lost, that is disease, and when lost is likely to be restored to the health. So in Ibn Sina's time, this art has been converted and shifted to the tag of science. People have accepted it as a science. Actually, Ibn Sina have not used the word of science. Rather, I think O.C. Gruner or Lale Bakhtiyar have translated canon of medicine in English language. They have used the word of science. But still, we agree that Unani medicine got the recognition of the science. Now, Ibn Rushd, in Kitabul Kulliyat, he has defined tib is the system of acquiring knowledge of those evidence-based principles which deal with the promotion of health and prevention against disease. Now, this definition is an idol, is a base of the WHO slogan in today's era, where WHO recognize the ultimate goal or ultimate target or the ultimate agenda of medical science is to promotion of health and prevention of the disease. The ultimate agenda of the WHO. In whatsoever way, you have to promote the health and prevent against the disease. Now this is the definition given by Ibn Rushd, and now this definition is being the sole agenda of the WHO. So now this is the definition and the assets we got in our medicine, Unani medicine, whom WHO and other people nowadays are recognizing. Now this is the working definition which you can tell people that Unani medicine is the traditional. Traditional means रिवायती तौर पर जो चली आ रही है. Indigenous is desi, which is based on local available medicine, desi medicine. Holistic healing system, holistic, where we consider body as a whole organ. This is one meaning, and another meaning, the religious text is incorporated in the holism. Like in Unani medicine, Dr. Amin have told the incorporation of Tibbe Nabvi. In Ayurveda, the incorporation of various literature belongs to Vedas. So many people understand this holism in different this thing. But the holism where we consider a body, when there is a problem in the stomach, it may reflect as a headache. When there is a problem in the head, it may reflect at the leg. So we consider body as a whole organ, where Unani medicine is a traditional indigenous holistic healing system based mainly on the use of plants and other natural substance, that is mineral and animal origin drugs for healing. So this is the working definition. We can tell people that this is nothing but a traditional, indigenous, your own system. The medicine, the things which is available in your local areas, that can be utilized for your therapy, for your treatment, which is more close to your nature, that is temperament. So that will be more suitable for you. So this is how we can introduce, make understand people what exactly the Unani medicine is. Next slide, please. Now, the conceptual structure of Unani medicine is based on philosophy. Accordingly, one must know what, why, and how. Basically, in philosophy, as I have told you, the philosophy has found the basic structure of the Unani skeleton. So, falsafe के अंदर तीन चीज़ है, क्या, क्यों, कैसे, what, why, how. So, when we read this golden triangle of what, why, how, we understand the human body and the philosophy, why to provide health and why to provide benefit to the human body. So what is, if we study the why and if we study the how and we study the why, the subject gets on deriving. Why we have to study, what we have to study, and how we have to study. This concept is known as metaphysics, and this triangle of what, why and how is known as golden triangle of metaphysics. Metaphysics is nothing but the branch of philosophy that deal with the first principle and seek to explain the nature of being or reality. مادے کے پہلے جو حیولہ ہے اور حیولہ کی جو تشکیل ہے, آپ اگر فردوس الحکمت اگر آپ پڑھتے ہیں تو اس کے اندر جو بیسک نفس اور حیولہ کا جو بیان ہے, وہاں سے نفس حیولہ بنا, حیولہ سے نفس بنا, پھر مادہ بنا, پھر اس کے اندر جان پڑی, پھر اس کے اندر روح آئی. تو اس طریقے سے اگر آپ میٹا فزکس کو ڈیرائیو کرتے جاتے ہیں تو اس کا امپورٹنس سمجھتا ہے کہ کیسے فلسفہ آپ کا انکارپوریٹ ہوا ہے فلسفی کے اندر. اس واٹ, وائی اینڈ ہاؤ کو آپ دنیا کے کسی بھی اسٹریم, کسی بھی پیتی پر انکارپوریٹ کر سکتے ہیں. ٹھیک ہے, نیکسٹ پلیز. ناؤ واٹ از the subject. Now the subject is Unani medicine is human body. What is the, why is the aim or maqsad or ghayat tib, that is health promotion and disease prevention, and how, that is method or usul ilaj or tariqe ilaj. So if we incorporate all the subject on the metaphysical triangle, so the subject get derives what is the subject or mawzu, that is human body. For that we must know what exactly the human body. Therefore we study tashrihul badan, therefore we study munafiul azar. Then aim or maqsad, what is the aim? That is health promotion and disease prevention. تو صحت کو قائم کرنے والے وہ تمام اسباب کو ہم کو اسٹڈی کرنا پڑے گا جو صحت قائم کرتے ہیں, اور وہ تمام اسباب کو ہم کو اسٹڈی کرنا پڑے گا جو مرض کا سبب بنتے ہیں. اس لیے اسباب کی تشکیل ہوتی ہے اسباب مادیہ, اسباب سوریہ, اسباب تمامیہ, اسباب فاعلیہ. یہ چار قسم کے اسباب بنتے ہیں. وائے جو فلسفے کا اصول ہے, وائے کیوں پڑھنا ہے؟ صحت کو قائم کرنا ہے, مرض سے دفع حاصل کرنا ہے. تو اس بنیاد پر وائے آپ کا کریٹ ہوتا ہے کہ وہ تمام اسباب جو صحت قائم کرتے ہیں. تو کون سے اسباب؟ اسباب مادیہ. مادہ کیا ہے ہمارے پاس؟ اخلاق, ارواح, یہ مادہ ہے. تو اخلاق اور ارواح کی تشکیل کسی کی ذہنی اختراع, کسی کی ذہنی دریافت نہیں ہے, بلکہ اٹ از دا نیڈ بیسڈ آن دیٹ گولڈن ٹرائنگل. وی ہیو ٹو اسٹڈی دس. سملرلی صورت, اسباب سوریہ, شکل کیا ہے؟ تو شکل کے اندر پورے آپ کے اعضاء آ گئے, اعضاء کی جو فیکلٹیز ہے وہ قوا آ گئے. تو آپ اخلاق پڑھتے ہیں, آپ ارواح پڑھتے ہیں, آپ قوا پڑھتے ہیں, آپ اعضاء پڑھتے ہیں. تو یہ کسی نے ایسے ذہنی طور پر کسی نے نہیں لاد دیا. آپ کو ہیومن باڈی پڑھنا ہے, ہیومن باڈی کی تشریح منافع پڑھنا ہے, اس کا مٹیریل کیا ہے, کس چیز سے صحت قائم ہوگی, کس چیز سے مرض لاحق ہوگا. اس لیے آپ کو اسباب مادیہ پڑھنا ہے, اسباب سوریہ پڑھنا ہے. تیسری چیز اسباب فاعلیہ. فاعلیہ ایکٹیو کاز which cause the health. What are the active cause? That essential 6 factor which are the responsible of health and disease. Therefore we study 6 factors. سب سے پہلے جس کو تشکیل جس نے کی, سب سے پہلی جو بک ہے جس میں اسباب ستہ ضروری کا ذکر ہے وہ مجوسی کی کامل الصنع. حالانکہ ان کے جو تشکیل تھی وہ اس طریقے سے نہیں تھی, وہ اس کے اندر تھوڑا زگزیگ تھا جو آج اویلیبل ہے, بٹ یہ جو تشکیل جو اسباب ستہ ضروریہ کی وہ ابن سینا کی دی ہوئی ہے کینن آف میڈیسن میں. تو وی ہیو ٹو فار پروموشن آف ہیلتھ اینڈ پریونشن اگینسٹ ڈیزیز. Therefore we study اسباب مادیہ, اسباب سوریہ, اسباب فاعلیہ, and then the last اسباب غائیہ or the ultimate تمامیہ cause, that is افعال, the function. The ultimate why, the health promotion, when the health will promote, when the body is in lively stage, all the function of the bodies are being carried out in the normal phenomena. Therefore we study why. So if we study that golden triangle, it will pave the way how to study these subjects, why to study these subjects. Okay, and then how, method or usul ilaj or tariqe ilaj. Here we will study all pathology, the clinic, how we will diagnose nabz, ball, baraz, all the part of mu'alajat. Here we will study this. So philosophy, now you are getting my point. how the philosophy are being incorporated in the conceptual structure, and how that basic metaphysical triangle give rise the born or the demand of the subject for which we have to study the human body. Okay, next slide please. Now, usul-e-ilaj and tariqa-e-ilaj. Friends, we are in the era where we have to standardize the things. There was an era which was based on personal this thing. हम क्या कहेंगे उसको, पर्सनल फेथ होता था, आदमी हकीम के पास जाते थे और उससे इलाज लेकर आते थे. ठीक है, ठीक है, अकीदा या फेथ जो भी था. नाउ दिस इज़ रिसर्च ओरिएंटेड बेस. आज फ़ायदा तो है पब्लिक को, लेकिन पब्लिक ये चाहती है कि डेटा वाइज उसको रिसर्च के ज़रिए हमको हासिल होना चाहिए, तब हम इसको मानेंगे. तो एक आज हम जिस एरा में जी रहे हैं कि वो रिसर्च ओरिएंटेड एरा है. ठीक है, अब ये क्या होता है कि आज गवर्नमेंट का जो 12th 5th ईयर प्लान है, एंड नाउ वी आर इंटरिंग इन द 13th 5th ईयर प्लान, वेयर द apex body of the health authorities are included Unani medicine in mainstream. Okay, so mainstream में जाने के बाद क्या होता है, वहाँ पर हमको चीज़ें जो है वो स्टैंडर्डाइज बतानी पड़ेगी. मैं इलाज के तरीके 4 बोलूँ, कोई 3 बोले, कोई 5 बोले, ये नहीं चलेगा. वी हैव टू सेट एन प्लेटफॉर्म. इलाज के तरीके कुल्लियात कानून में, फिरदौसुल हिकमत में